Hello, good day to you. It's me, Andy, and this is a story in the Mirror. So the Mirror reports a sick kid parents has been asked to sign DNR if they get the coronavirus. Shocked parents are asking if their kids' lives are thought not worth saving, as most vulnerable are asked to sign Do Not Resuscitate. So this story we can have a look at is in the Mirror, and of course it's a headline grabber. Parents of vulnerable and sick children are furious after being asked by GPs to sign DNR orders if their loved ones catch the virus. One shocked mum, Margaret Suddes, whose 11-year-old son Ilan has cancer, yesterday branded the life or death request as inhumane. Another enraged mother claims her 16-year-old son was called directly by their GP surgery to ask to consent to a DNR form. The order instructs medics not to perform CPR if a patient stops breathing or their heart stops. NICE, National Institute for Health and Care Excellence, has told doctors to assess people with learning disabilities, autism or cerebral palsy, so that's me, on a clinical frailty scale, meaning that some would be denied hospital treatment. And what that does, the clinical frailty scale, determines the abilities of the patient to perform certain actions. So obviously things like looking after yourself. Days later, NICE did a U-turn after being challenged by disabled charities, but there are concerns about how the guidance is being interpreted. Ilan of Scarborough, North Yorkshire, has a rare form of cancer. He has to feed through a tube and has a hole in his throat to breathe. Mum said that the shock call from her GP surgery came totally out of the blue. They asked if we wanted a DNR if he had to be taken to hospital with coronavirus. When I complained, one GP told me that there had been a mistake. But how on earth can someone see an 11-year-old boy age on a computer and think that it's responsible behaviour? She added, Ilan has fought cancer for 7 years, bearing in mind that he's only 11 years old now, and there's been no way I'm going to let anyone give up on him. Nobody has the right to decide whether somebody is worthy of CPR or not. There was no one available for comment at the surgery, which we have chosen not to name. So yes, I mean the whole idea of DNR is behind the facade of resources. This is what it comes down to. If somebody is a burden, i.e. cannot look after themselves and requires a lot of care needs, they are in their rights to withdraw any health care. So if they stop breathing, for example, it's considered okay to let them pass on, because the cost of that and the cost of future care would not be cost effective. What they're saying is that a person's life is not worth the same as somebody else's, and certainly when you have disabilities, and as they have mentioned there, CP, cerebral palsy. If I went to hospital, I'd have to be very on the ball, because there would be a danger that they would try to get a DNR, because of my disability, even though I am perfectly able to look after myself. I may not be able to move around and walk a long way, but I can look after myself. So they are making a judgment about me in a medical setting. So am I worth saving? And this is the whole point about DNRs. So the idea behind DNRs is cost savings, basically. But this story is not unique. We've had one already this week with the learning disabilities, and we've had that several times. And of course we hear about this quite frequently, where elderly people have been coerced into signing DNRs. In actual fact, my 83-year-old dad has been requested, does he want to sign a DNR? And of course my sister and I, sort of suggested that he doesn't need to sign it. It is sad, I know, and it is all about money at the end of the day. And when you look at the NHS and what state it's in, we realise that it is down to money. But when you look at the money that they wasted in the last year and the pointless things that they do, i.e., for example, the Nightingale hospitals that they made and then they dismantled. I mean, they wasted millions of pounds on that, and they could have put that money into the NHS, but they didn't. That's it. Have a good day, and I'll catch you next video.